Oh, hey, Doc. What's the best thing to use to treat calves with pneumonia?
Well, Generic Rancher Ron, I can see where your question comes from because there's a lot of different options that you can use to treat pneumonia with. For example, this is a list of all the different antibiotics that are available for cattle that have a label for pneumonia. Obviously, there's a lot of choices, so to decide which one is the best gets a little problematic. To make the list a little more simple, I'm going to give you a bit of advice. Although the tetracycline antibiotics may have worked pretty well in the past, I don't hold a lot of faith in them now in order to stop a pneumonia problem in a calf. So I would take those off the list and save those for more minor incidences like foot rot, for example. This still leaves a pretty extensive list. So what I've done on this list is put antibiotics in their different classifications. Each of these different classes have unique properties that might make an antibiotic a better choice for a certain situation you might have with pneumonia. To start off with, we've got the Macrolide class. These drugs in this class that are listed are all single treatment, long duration antibiotics. Most of them will last for at least a week. This makes a macrolide antibiotic a good choice for calves that you don't have the opportunity to catch again and retreat. For example, summer pneumonia problems, which are probably some of the biggest things that we're thinking about right now. Now on the left here we have two different classes of antibiotics, the quinolones and the phenocols. These drugs don't have as much longevity in the animal as the macrolides do. However, by being a completely different class, they may work on a pneumonia that a macrolide antibiotic won't work on. So in general, if I treat a calf with a macrolide antibiotic for a first treatment, and maybe there's a second treatment required in the next week, I'll come back with either a quinolone or a phenocol antibiotic. Now the last class listed here are the Beta-Lactams. This is a very unique class in that there's only one antibiotic within the Beta-Lactams that has any sort of longevity, and that's Exceed. Most of the Beta-Lactams that you can think of are pretty common to use in other situations. For example, penicillin is a Beta-Lactam. Amoxicillin is a Beta-Lactam. But the thing about those drugs is they have to be given daily. That's not necessarily practical for us when we're dealing with beef cattle. Hence the reason why Exceed is the only one I have written here on this list. Now, I'll use Exceed in certain situations in the same way that I would use the quinolones or the phenocols, not as a first treatment drug, but rather as a second treatment. Now, while this gives you a basic idea of the different categories of antibiotics used for pneumonia in cattle, and maybe some thoughts on what order you could use in treating cattle that need an antibiotic to overcome a pneumonia infection, that still leaves the questions within the category. Which one of these macrolides is the best one to use on the first treatment? Of the quinolones and the phenocols, which one of these is better to use? I will tell you that that varies from place to place. There's a lot of different data out there, and to be perfectly honest, a good chunk of it's conflicting as to what works the best. And I think the reason for that is that it depends. It depends on the pneumonia you're facing. It depends on what your cattle respond to the best, and it depends on how it's given. With all these factors in mind, what I would say is come into one of our vet clinics and talk with our veterinarians about what seems to be the best for your situation. For example, if you have a pen full of cattle that are all breaking out with the disease at once, I might select one antibiotic. However, if you have animals that are breaking out with pneumonia on more spaced out intervals, I might go for a different antibiotic. When we know what your exact situation is, we're going to be better suited to help you answer the question about what would be the best antibiotic to use. So folks, by all means, come and visit one of our veterinarians here at Sioux Nation Ag Center. We're here to help answer all those questions you might have, not just about antibiotics, but anything else in cattle health. Because healthy cattle obviously are better at feeding that bottom line. Now folks, before you go, there might be some specific questions about summer pneumonia. As I alluded to, I would pick out of the macrolide categories to treat a calf on grass for my first choice. Of these all have various different attributes that make them better in certain circumstances versus other circumstances. But one thing I would keep in mind is is that if you're going to be out treating calves for pneumonia in the pasture and things can get a little western out there, I would probably not use Micotil, because if you inject yourself with Micotil, that can be fatal to your own health. Rather, I would stick with one of these 3 other drugs in that situation. I like using Micotil, but I'll only give it when the cattle are in the chute and fully restrained.